Hello, everyone. My name is Erin Hager, and I am the chair of the Maryland State School Health Council. Welcome to our SHIP conference webinar titled Implementing the WSC Model in Schools to Support Mental Health, What Schools Can Do. So over the next hour, you are going to hear from a number of speakers that will address this topic. And specifically, what we are going to do is give everyone a very brief introduction of the WSC model. So we say WSC all the time, and I realize that not everyone knows what that is. So we'll dig in deep to tell you a little bit about what the model is all about. I will then present just a single slide on the ongoing research onto pediatric mental health concerns stemming from the pandemic. And then you are going to hear the meat of our webinar today, which will be a series of vignettes addressing the main topic of today. So implementing the WSC model in schools to support mental health, what schools can do. And for each set of presenters, so we'll either have one or two presenters for each topic, you will hear their experiences in addressing this specific area of the WSC model as it relates to mental health. Then you're going to hear some general recommendations in addition to recommendations specifically in response to the pandemic. So as we return to school this year, what can schools do to support the mental health of children in each of the 10 areas of the WSC model? And then we're going to wrap up by giving you a little bit of additional information on what's coming after this presentation today, in addition to how to join the Maryland State School Health Council if you are not a member already. So I'm going to start with a high-level overview of the WSC model. So if you are a few minutes into this presentation and really have no idea what we're talking about as far as WSC goes, it stands for Whole School, Whole Community, Whole Child Model. And we use the word WSC, which doesn't really represent what we're talking about very well commonly, and it's usually what many of us refer to this model as. So this is the model in the center, and we'll be showing it throughout the webinar today. This was developed by the Association for Supervision and Curriculum Development, so ASCD, in partnership with the CDC, and it is the recommended wellness framework by the CDC, ASCD, and lots of other health promotion organizations. And so what this does is it integrates the coordinated school health model. So remember, before we used to have 8 components of coordinated school health. Now there are 10 components of the WSC model. And what it did, it took those 8 components and built on them a bit, and then also integrated them with these whole child tenets, which are more widely known by educators. So we're kind of bringing together the school health world and kind of those educational tenets that go into a lot of the specific curriculum development concepts and bringing those two together. And so you can see the intersections between health and academic achievement in a single framework that speaks to educators and health professionals alike. So again, we have these 10 components of the WSC model, and that's what we're going to dig into today. So we have speakers who will talk about each of the 10 components individually as individual vignettes, and how each of these 10 components will relate to child mental health, again, in general and in response to the pandemic. I also want to point out that at the center of this model in the green are these healthy, safe, challenge supported, and engaged tenets of the whole child. These are the core tenets of the whole child, and they are surrounded by the 10 school-based components that support a child-focused vision for health and learning. And then one of my favorite aspects of the model, so I forgot to mention the inner white circle of coordinating policy, process, and practice, and improving learning and improving health. So those are kind of the ultimate goals of this model. And then one of my favorite aspects of the model is that we say that it is hugged by the community. So we really want to emphasize that the community is a big part of this model, so that we're bringing together, again, the whole school, whole community, and whole child together to advance health and academic achievement among children. So you can easily read more about this model on both the ASCD website or the CDC website as well. So now I'm going to pivot a bit to our other kind of main topics. We're going to talk about the WSC model, and we're going to talk today about pediatric mental health concerns. And I'm sure many of you who are watching this webinar are school health experts who work heavily with children stemming from the pandemic, and so this will not be new news to you, but there is a great concern about mental health of children as we return to school post-pandemic. So these are just 2 studies that have recently come out. One that I wanted to mention to you all is a review paper. So it brought together data that had come out soon after the pandemic occurred and lockdowns occurred. So these studies mostly relied on surveys, seeing how kids were doing, asking about changes and things like that over time. But also we've been able to draw as researchers on prior disasters. So disasters that have led to widespread school closures, widespread home-centered lockdowns, things like that, to really understand what the likely impact on mental health of children will be, again, in the long term and in the short term. And so this review paper kind of brought all of those bodies of literature together and identified that we were already seeing an increase in mental health symptoms. We were expecting to see an increase in mental health symptoms based on those prior studies, and that the impacts would be more extreme for vulnerable populations, and they specified children and those from economically disadvantaged families. Again, this is maybe not new news to those of you who work in school health, but it's something that we need to emphasize, that there is science supporting that this is a big concern. To date, there's been one nice longitudinal study in the US that examined mental health concerns of children prior to the pandemic, actually at 2 time points. And then again during the pandemic, and this was about 100 families. I wrote 100, but I'm realizing now it's a little over 100 families. And they found an increase in child mental health symptoms adjusting for maturation. So adjusting for that change and growing up and getting older, which also happens, with kids, they continue to keep growing up and getting older. And they did find that the impact of the pandemic was mitigated to some extent by pre-pandemic self-efficacy. So in this case, the children who reported greater self-efficacy were more protected by the impacts of the pandemic on their mental health outcomes. So again, there is research growing. More and more research is coming out all the time on the impact of the pandemic on child mental health concerns. But that's really why we wanted to address this specific topic for our webinar today. And so you are about to hear our series of vignettes. So again, there will be 10 different vignettes that we recorded at 10 separate times. So we have worked together with our team to kind of splice all of these together so that you will have a really interesting experience of hearing lots of different speakers at lots of different time points. And again, the overall topic you're going to hear about is implementing the WSCC model in schools to support mental health, what schools can do. So enjoy the series of vignettes, and then we'll wrap up with a closing, and we'll tell you a little bit more about where we're headed with this broader project.